Yeah. Alcohol Morbidity, A Health Disparity for Native Americans by Bobby Latham. My directed audience for this PowerPoint presentation are alcohol treatment providers. In this presentation, I will be discussing alcohol mortality, what that means, health disparity meaning and why alcohol mortality is a health disparity for Native Americans, the statistics that highlight this disparity, a brief history to give context to alcoholism in Native American culture. I will discuss the causes behind this disparity and then the possible solutions to close this divide and end this disparity. So, what is alcohol mortality? What does that mean? The CDC Centers for Disease Control and Prevention describes it as deaths that are, by definition, due to alcohol consumption and could be avoided if alcohol were not involved. The CDC uses codes that are recorded on death certificates to accumulate this data. When a person dies, all of their cause of death information and demographic detailing is recorded with these codes. The International Statistical Classification of Diseases and Related Health Problems breaks down these related codes. 1, we have pseudo-Cushing syndrome. 2, mental and behavioral disorders. 3 is degeneration of nervous system, polyneuropathy and myopathy, cardiomyopathy, gastritis, liver disease, pancreatitis, findings of alcohol in blood, and obviously alcohol poisoning. Let's talk about health disparity. The National Institutes of Health established a definition of health disparities. Health disparities are differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that exist among specific populations groups in the United States. To put this plainly in this context, Native Americans and other minorities have the same rate of alcohol consumption and abuse as white people. The disparity comes in that Native American alcohol-related mortality is double that of the average US population. As you can see in this bar graph displayed with Native Americans in the center, towering over all the other demographics, male rates are consistently higher than female rates. Consistently overall, Native Americans double everyone else in alcohol mortality. So let's discuss some statistics. Based on a 30-day survey done on any alcohol use in adults described as 18 and older, we can see here Caucasians are at 59%, Native Americans 47%, Hispanics 46%, Blacks 43%, and Asian Americans 38%. Not much of a variation, not much of a change. But then when we look at deaths attributable to alcohol, we have Native Americans at 20%, whites 9%, blacks 7%, Asian Americans at 4%. The US general population is at 11%. As we've just seen, alcohol rates otherwise are pretty consistently across the board the same for every demographic, even minorities. But somewhere along the line, it gets to deaths attributable to alcohol, and suddenly it is doubled. This is where the disparity comes in, and we're going to discuss why that is. There are some factors of statistical anomalies that have been contributed to this disparity, being shrugged aside for a long period of time. Demonstrated by this map displayed, we see multiple areas of broadly described tribal regions. Alaska Natives and Northern Plains lead in the numbers. The Northern Plains region even has a historical record of lower life expectancy overall, likely due to the much higher impact of alcohol mortality in the region. Specific regions have varying degrees of impact by alcohol. Broken down even further, there are as many as 300 different tribes and language groups in the US alone. Continuing with that train of thought even further, there's a problem of race misclassification on death certificates. Not only are alcohol deaths double for Native Americans as it is, but in certain states, Native Americans can be wrongly classified as much as 30% of the time. This disparity has been minimized by inaccurate representation on many ends. Let's take a bit of a history break. Broadly, much of this history we learn in grade school, but let's put it in the context of this disparity. Alcohol was introduced by pioneers during colonization. Native Americans had access to local ceremonial beers before this point, but nothing compared to urban, industrial level hard liquor brought over by Europeans. The pioneers would use gifted hard liquor to natives as a trading tactic to get the upper hand in negotiations. Native Americans were completely unprepared for the impact of hard liquor on their communities. Europeans had many generations of development in the impact of hard liquor on their society as it developed, but Native Americans received this gift like a ton of bricks, all at once and with no chance to adjust. The 1838 Trail of Tears is the most commonly known part of the relocation of Native Americans in the 1800s to impoverished reservations. These reservations were overcrowded and full of the wide variety of native tribes. Poverty and all of the stressors that come with it grew in these environments. The next phase of this acculturation was the late 1800 acculturation boarding schools. Missionary contracts began in 1865 to acculturate Native children into Western society. By 1887, boarding school enforcement had begun. Federal authorities could forcibly remove Native children from their homes and take them to boarding schools. In 1928, the Merriam Report was done collecting information on the state of these schools. It brought to light the abuses conducted by these schools and the conditions of the reservations. Rampant disease, death, and physical abuse. It wasn't until 1975 that there was a dissolution of these schools and federal oversight of reservations was scaled back. The impact of this cannot be understated. Almost 100 years of Native American generations lost their culture. Children who returned to their tribes after these schools were shunned. They knew nothing of their culture and had lost their language to even communicate in their tribes. Generations of parents didn't raise their own children, and these children grew up to have no experience in raising their own children after them. The ripples of this cultural genocide are still felt today as shown in this health disparity. This brings us to the causes and contributions, most of which we've already discussed. Genetic risk factors have been studied but have resulted in no impactful genetic foundation. Social and cultural factors such as acculturation and economic disadvantages, these are all proven to lead to increased stress and family tensions. Socioeconomic disadvantages resulting from racial ethnic discrimination, such as poor job opportunities, residential segregation, unsafe neighborhoods, overexposure to alcohol advertising, police profiling and brutality, lack of access to adequate health care. Let's highlight this major source of the disparity is the loss of Native American culture. There have been developed a cultural tradition of extreme alcohol use. The quote, drunken Indians stereotype is not only used in a broader society, but has been adopted as part of culture in Native American communities themselves. Boarding school Native history having a large impact on the stripping of Native American connection to tradition, leading into alcohol treatment centers that are designed for secular treatment versus spiritual. Meanwhile, the Native Americans, who as a result of acculturation, have extremely varying levels of this acculturation. So let's get into the solution. A united effort by alcoholism treatment providers is the solution to this disparity. In an attempt to enact culturally appropriate treatment, Native American reservations, with their newfound ability to self-govern, have instituted their own community-level alcohol treatment programs. Realistically, though, as a result of all the history discussed here, only 22% of Native Americans live on reservations. For the other 78%, there's a wide and varied gradient of individual cultural and spiritual needs to be met. Studies have been attempted to focus on the spiritual impact of alcoholism recovery, but have been unable to really classify and quantify culture and spirituality in research setting. These studies and attempts should not be given up on. Studies have been done in treatment facilities that have been making strides to adapt to the range of Native American culture. Integrating culture in Western medicine clinical treatments has been attempted already with success. Acculturation of individual Native Americans is a spectrum that complicates this. Allowing individuals the opportunity to self-identify at the cultural level they are comfortable with and learn to apply to alcohol recovery has, quote, been associated with increased level of psychological well-being, including higher self-esteem, more internal focus of control, and fewer behavioral problems when compared with those who connected with only one identity or with neither, unquote. This adaptability allows treatment providers to reach all levels of Native American culturalization. Clients that have no connection to their ethnic history only feel excluded in traditional Native treatment. Introducing cultural ceremonies and traditions appropriately helps individuals become more fulfilled in their current and ethnic history. For this solution, ethnic sensitivity and awareness by health treatment providers is necessary. A united effort by alcohol treatment providers can finally bridge the alcohol mortality disparity gap for Native Americans.